Hello, Parita. Very happy to have you. Welcome to our podcast, Master AI Disruption.
Hi, nice to meet you, Francis. How are you?
I'm good. I really enjoyed our previous conversation to prepare for this podcast, so I'm excited to have you now. Um, Parita, you're calling us from Tampa, Florida. Your company is called Parita Health Services. And why don't you tell us a little bit about your story of origin? Because I've had an interesting journey and a very accelerated trajectory the past few years. So tell us all about it.
Yeah, absolutely. I've been in the health insurance space since 2021. Prior to that, after I graduated college, I was in corporate America for about 4 years. From there, I kind of went into some startups, exploring entrepreneurship. It was around a time frame that the world was very much affected when the pandemic hit, and some of those endeavors ended up falling through. So then I eventually found myself looking for a new path and a new career, and health insurance ended up finding me. So I've been doing the insurance sales now since 2021, and currently I'm building a team here in Florida. It's definitely been a fast paced level of success for me these last 5 years. A lot of people think that it was an overnight success, but in my opinion, all the 10 years of work prior to that success was all part of the process and building of what ended up helping me succeed right when I got into this space. Everything that I had learned in my previous jobs helped me succeed when I got here. But health insurance is something everybody needs, right? And it just comes down to where they get it from and who they get it from. So the private health insurance space is specifically where I kind of specialize, which is different than traditional insurance. So we're definitely helping people save a lot of money and get better protected, but it's not plans necessarily for the entire population because you have to be in relatively good health in order to get qualified for the plans. But building a team has been my priority now because I've kind of mastered the art of selling myself. I ended up actually going onto social media to be able to help people, find these types of plans. And social media is an endless lead source, if you will. So I was able to really hit a big market there. That's what kind of helped accelerate my success. And again, once I mastered the selling part, it's more about now helping my agents and helping them succeed and being able to reach a bigger audience and just continue to help people every single day.
Okay, so I've got two questions from what you just told us.
Sure.
So, what first of all, what were you doing in corporate America, and what have you learned that you applied to insurance? Okay, so people can identify. Oh, yeah.
Absolutely. So corporate America for me started at in Minneapolis, Minnesota,
Mhm.
at Target headquarters. So everybody knows Target, and that's where they have their downtown Minneapolis headquarter building. I was a business analyst there, and I was definitely a small fish in a very big pond. Right? It's a huge company. Thousands and thousands of employees. I learned very quickly that the job itself was not super challenging, what I was doing. And I found myself working, a 40-hour week job, but I was getting everything done in 15 hours or less. So I felt like, I learned that I could use more of a challenge and I needed to be able to make a bigger impact. And sometimes in large corporations, it takes a lot of time and effort to make the smallest change
Mm.
because a lot of companies are very stuck in their ways, right? They have their systems, their processes. This is what they do. And you have to jump through a bunch of hoops in order to even make one small change happen, right? So that was definitely not where I found, a lot other than just being exposed into the corporate world.
Sure, but
It
what did you learn? You said, like, my 4 years in corporate really helped me, manage my.
So, yeah, it wasn't my corporate that helped me. It was the 4 years after corporate when I was doing entrepreneurship. So, I started working for a startup company. It was a fitness company, so we were opening up small gyms and, I was the chief operating officer. So, I started off as a trainer and then the owner kind of saw that I was really passionate about business and very organized, so he made me his chief operating officer within 3 months of me starting at the company. And then it was just about building the infrastructure to allow for scalability.
Mm.
So they had one successful location. How do I duplicate and expand the one location into multiple locations?
Mm.
And that was my main job. But when you're in operations, you have to do a lot of different hats, right? So we're finding the locations, we're building the studios, I'm hiring trainers, I'm training the trainers, I was training the clients because I had a few clients,
And
created
you
the
were, you were training clients too.
'cause I got my personal training degree, so,
Okay,
you
okay.
know, I
Why
I
not?
wanted to do something I was passionate about, and I thought
Yeah.
helping people be healthy would be good.
Yeah, yeah.
Yeah,
Plus also you were, in the field, like on the floor, you see
exactly.
what was going
Yep.
well, not well. It's always the best, it's like retail floor. You learn a lot. Okay, I get it.
Absolutely. Mhm.
And then you grew up to 90 agents, right? And then you
Yeah.
reduced to 30. So tell us more how you got to 90 and when
Yep.
you decide to scale down.
So in 2022, it was when I started to build a team in the insurance space. So I had previous leadership experience in the fitness company. So I knew how to, attract people and do some recruiting. And we had a duplicatable system. We were able to teach people how to get on the phones, how to talk to leads, how to help clients with their health insurance situation. So started slowly building a team. The following year, I got promoted, and anytime you get promoted, you might merge with another team or acquire another team to become a higher level of leadership. So
Mhm.
that's kind of what happened. So I went from having maybe my 12 agents, then I got promoted to take on another, 15, 20 agents. And then by my third year, I got promoted again when I acquired multiple teams, and that's how I got to about 90 agents. So we're building, just training and duplicating. And after I had those 90 agents, there was definitely a few challenges that I was having within the leadership team and how some things were being run and the scalability. So I decided to take a step back. I kept my original core team that was with me from the beginning, and we kind of broke off and started to rebuild on our own. And that was just something that I noticed that within the business, we're bringing a lot of people on, but there weren't enough resources to support the growth of that team. And it started feeling like we were bringing people on, but not everybody was able to succeed.
Mm.
So I wanted to be able to just like, clean the process up a little bit. Let me slow it down so that the resources I have, I can bring maybe one or two people on every single month. That way, each person has enough
What you are
support,
doing.
training.
Yes.
Yeah. Otherwise, you try to grow too fast and then you don't have enough, to be able to help it be sustainable. But that's kind of what happened there.
Okay, but from the beginning, that was your agency, yeah? Because you said I got promoted, so I didn't understand that.
So I contracted with companies to be able to sell additional products, and
Okay.
there's other teams that are also part of the company. So then, there are times that they ask you to merge and take on additional responsibilities. So there is a bigger name, but my team was a part of a bigger team, if that makes
Okay.
sense.
And today? And today you're fully independent or you're still working?
We're still working together with other teams. We still kind of run our own operation, but we're doing it with other insurance agencies under one roof.
Can you tell us which roof it is or alliance you have with them?
Well, everybody's kind of independently contracted as well, so it's not like there's just this one company. We all have contracts, so it's a different world in the insurance space and how everything operates, but we are all 1099. We just kind of run our operations in a
Okay.
similar
Is it
workspace.
is it like an FMO or is it like an MLM or is it which
No,
system is it?
no.
So you're just a coalition of independent brokers
Yes.
who come together for the purpose of what? Of just like supporting each other or having like shared functions or shared corporate function?
Yeah, absolutely. We definitely all collaborate as much as possibly because we're all after the same thing and we're all kind of, under the same mission. It's just that why do it alone when you can do it with more people?
And is there like a united leadership team that supervises all the 1099 agents? So
We are contracted with some of the same providers and carriers. So I know that, for example, United Healthcare is one of the umbrella organizations that we work with, and we have access to their private sector as well to be able to have, similar products that we're selling and things like that.
yes, got it. And you don't have any exclusivity to anyone. You're not a captive. Yeah, yeah.
We all kind of specialize in our
Sure,
private space.
sure. No, no,
Mhm.
I get it, but you're not, you're not
My
exclusive
team
to
is
any sorry?
yeah, my team is definitely captive. We are
To
captive
whom?
to private insurance.
Oh, okay. Okay, okay, got it. You are working with those careers, and the careers have put together this coalitions, this group of independent brokers. Is that them who put you together?
Yes,
Okay. And what's the name of this entity?
that is US Health.
Oh, US Health. Okay, got it. I understand better. I didn't know. Okay. So you grew within a structure,
Yes.
and because of your entrepreneurial, training, but also your corporate training, you understand structure. You understand also adaptation and entrepreneurship, and you understand. So it's a kind of a nice mix for you, being
Yeah, you have a
yeah.
lot of independence, but you still have people that you can turn to if you need some
Yes,
kind of support, but you still have
yes,
to run your own operation. Like
yeah, yeah,
I'm responsible for my overhead. I'm
sure.
responsible for what systems I use and how
No, no,
I
I know.
hire.
Great. I
Mhm.
think for you it was perfect based on your previous experience. It was just perfect,
Right.
like you. Okay, great. Well, thank you. U.S. health. All right. So what have you seen, as trends on the market as you've been faring this industry? What are the trends
Um,
that you, let's say, that you see moving forward? Yeah.
Yeah, honestly, all I'm seeing is that, the medical industry, the insurance space, everything is just getting more and more expensive. The cost of care has gradually increased over the years, and you almost wonder, where does it start, right? So, for example, the cost of medical care is very expensive. The cost to obtain a medical degree is also very expensive. It's the pharmaceutical companies that I think that are winning at the end of the day because their margins on the things that they create versus how much they're selling it for, it's outrageous. Obviously, you have equipment that's super expensive. So it's like you don't know where the blame should fall on why everything is so expensive. But the more expensive treatments are, the more expensive care is, the
Yeah.
higher the prices of insurance are going to be at the end of the day.
Yeah.
And the government is not necessarily doing what they used to do by subsidizing and making sure that things are not overly expensive. Everybody's priorities are all over the place. So the only trends that I'm seeing is higher costs, higher deductibles, lower benefits year after year after year. That seems to be the general formula since I've been doing this the last 5 years.
Yeah.
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 Which is unfortunate, but it's almost like I tell all of my clients, I'm like, listen, our options are not great. So we have to pick the best out of all these horrible options, you
Yeah.
know?
Yeah.
But that's the reality of what's happening in the US right now. It's not like it's above my pay grade to be able to have any impact on something like this.
Sure. Of course.
Um,
Of course.
yeah, and you're running out of options to be able to help people solve all the problems that they have. So that's kind of where we're at.
Yeah, yeah. I spoke to you last time about a solution that we'll discuss later that kind of disrupts the model to like provide at a fraction of the cost, similar coverage with no limitations in network. So that's kind of a disruptive model. They had to step outside the insurance to be able to cover people better. Okay, so we'll talk later. But
Yeah.
anyways, yes, you're right. Like where it's going because the tuitions in universities in Los Angeles are incredibly high and gets more and more. Okay, and that's interesting because the providers don't really get much more money, because if
No.
they don't, they just don't. So actually, the profession itself of providers, they're not benefiting. It's actually harder and harder for them, from what I'm hearing.
Yeah, and both of my siblings are doctors, so, like, they see that side of the industry, and I'm on this side of the industry, and everybody seems like they're kind of losing, and I think about how my siblings have to have insurance just for liability purposes because
Yes.
doctors, it's like they can't even provide the kind of care that they wanna provide. And you have a doctor who's seeing 30, 40 patients a day, right? And so they can barely give the level of quality care that they want to, right? And when they're being pushed to provide care like that, it's also like, okay, things can happen. There's no perfect science when it comes to the
Yeah.
human body. There's
Yes.
only so much that we know, and now they have to watch their backs because people are constantly putting lawsuits in people's faces, right? So
Yeah.
the medical profession, it's like you have to go into a ton of debt, a ton of schooling, and when you get out, it's going to take some time before you start making some good paychecks, but it's going to go all towards your debt in the beginning. And now, as AI progresses and robots are progressing, people are worried about their job safety, and doctors never had to worry about that before.
Yeah.
But for example, radiologists, like it's gotten to the point where 10 years from now, that position might be obsolete because you can have a supercomputer read a scan maybe better than a human that has the potential to make errors, right? So, yeah, I know that it's becoming very discouraging for people to even go into medicine, yet we have a lack of doctors and good care. So, it's a little scary, right, to think about it in the long run. And, I don't know if other countries are doing it better or not. Maybe they are, maybe they're not, but universal health care is not coming to the United States. I can't imagine
No,
anytime
anytime soon. Yeah.
ever.
Though, how do these trends, excuse me, influence actually the development of a company, of your agency?
Yeah.
Uh,
Well, lucky for us, the products that we sell, the idea is not to sell anything. The idea is to solve problems. But having access to these kinds of plans means at least we can help the population that we can help. So our plans are medically underwritten. What that means is if you have relatively good health and maybe you're not using the medical care as much as somebody that has a major pre-existing condition, then you can qualify for better coverage and better rates because you're part of a healthier group of people who are not bringing as many expenses to the insurance company, right? Because you have your, the general population that are not having comorbidities or any major pre-existing, like why should they have to pay thousands of dollars a month for health insurance when they don't even use it?
Sure, sure.
So that's who we specialize in. And then you have the public marketplace to help the people that have pre-existing conditions. So at least we have a solution, even if it's for just a small part of the population, and that's who we focus on.
Understood. And do you favor people who are proactive with their health, like, going to the gym or alternative? Does it lower their deductible or their premium?
Well, I do know that, for example, you could have better premiums if your height and weight and your BMI are in
Yeah.
control. So indirectly, yes, if you're taking care of yourself, you're going to benefit somehow. Because again, why should those people have to pay for other people's lack of care? So there's definitely some indirect correlation there.
Okay, got it. Got it. So moving forward in the growth of your agency, what do you see in the future for you in terms of the outcomes that you have to put in place to move through certain obstacles on the market? What would you say is on your radar? In
Yeah.
terms of yeah,
I definitely think that the industry itself is having a lot of issues with, a lot of people are joining the health and life insurance space. The problem is that because people are not taking it as seriously as they should, it's kind of like when you have a personal trainer in the fitness space
yes, yes,
who
yes,
it's very easy to get a license. It's very easy to pass an exam, but there's not some extensive level of education when you're in this field, whether it's health insurance or personal training. So you've got people that are experts in their field when they're not actually getting the type of training and education necessary when you think of how important their jobs are. Like as a personal trainer, someone's health is directly in your hands with how you're pushing them, how you're challenging their body and their muscles, and some people are just doing a lot of like fluff and it doesn't mean anything, but they're taking money from people. In the health insurance space, I don't think people realize sometimes how serious what they're doing is. Like,
mm,
if I have a family and someone ends up in the hospital, I need to make sure that their insurance is going to protect them.
mm,
So, when you have all these agencies that are just popping up left and right, I'm building a team, I'm hiring, but they're not taking the time to accurately train those agents. People are starting to have bad experiences with what they're being sold. They're not getting the fine print. They're not understanding those little bullet points that say this is excluded, and then they end up having these big bills all of a sudden, and now nobody can trust health insurance. So because this is becoming a very growing industry, right? So that is a problem that unfortunately is falling into my lap too, because when you have clients that don't trust you,
mm,
that they've had a bad experience, now I have an uphill battle. So what am I doing about it? I'm just going above and beyond to make sure that I'm teaching my agents the right way to
yes,
do things.
yes, yes, yes,
Um,
yes.
integrity is so important. Values are so important. If you're chasing the income potential versus chasing helping people, I got to redirect the way people are thinking about this space because of the previous people that have ruined it. So that's definitely something. And, it's an uphill battle, but I'm ready for the challenge.
Yeah, it sounds like it. Yes, okay. So there's another big trend, and we discussed it last time. So AI, and
Right.
you were discussing it with doctors. So how do you see AI intersect with your next level, of your agency?
Yeah. Well, I've been starting to see it over the last 6 months, 8 months or so. Open enrollment is insurance season, which is November and December.
Yeah,
And one thing I found is that a lot of the public are turning to AI for clarification of information. If I send them a brochure about a plan that they could consider,
yeah,
they'll upload it into AI and they'll ask AI for, hey, how good is this plan? The problem with that is that you could upload one part of a brochure and it doesn't give you the full picture of how the plans actually work. So it's almost like AI is supposed to help with giving us quality information, but it's actually doing the opposite because it's missing a lot of the pieces of how
yeah.
these plans operate. So AI has actually been a little bit tough for us because it's working against us. I do think that our industry, especially when it comes to like relationship building and trust and sales, like I definitely think that despite the uphill battle, it's never going to take away the jobs that we have, because I know that's what most people are worried about is AI taking over jobs, but the human connection that's necessary for something like putting someone's health in your hands,
Yes.
I think that is going to be always invaluable. So I don't think it's going to take away the jobs, which is great. I
Mm.
just think that we have to make sure that, again, people are trained up enough to be able to confidently speak to the products and answer people's questions so that they don't get misinformed by AI. I think that's really kind of the main thing that AI is providing. There was a company that had reached out to me about creating kind of like an AI bot to make phone calls,
Yeah.
because a lot of insurance agents, what we do is we do outbound phone calls.
Yeah.
We,
Sure.
we call leads and things like that. And they were like, we could basically duplicate you. We can teach,
Knowledge base and
yep, how you talk about products, how you answer people questions. If you have a common list of questions that clients like to ask, we can create a voice that answers just like you.
Mhm.
And so I thought, okay, if there's a way that this can help alleviate workload for my agents, then I'm
Sure.
willing to explore it. The problem was is you can't, it's still a robot. It's not a human, you know? So it ended up being a path I didn't really explore, but
Yeah.
that just gave me further confidence that this is not going to take away from our.
Wonderful. I understand. I understand. So 30 agents, how many clients do you have on your roster, or just like, and where do you want to take it to the next level?
Yeah, I'm about to actually have, I don't know, I think I told you this last time, but I'm about 8 months pregnant, so I'm about to take a little bit of a moment to live life and have a baby on my own. So I'm definitely taking a few months time there, but the team is going to still operate because we've got them trained up and ready to go. I would love to say that I want to double in the next year. At least next 18 months. And we do bring on 4 or 5 agents every single month, and we're trying to grow and expand on that end. So I would definitely say that that's very possible for us. In terms of clients, I mean, there's a huge market of people that can qualify for the private sector. It's just a matter of being able to reach them and let them know that we exist. So I'm hoping that we can double our client base soon as well. Again, I'm not necessarily taking on a lot of clients myself because my focus is my team. But, if every single one of my agents was able to help 100, 150 clients every year, I think that is a sustainable book of business.
Sure.
And I think that that still allows us to give the quality care because we provide kind of like a concierge service to our clients. That
Yeah.
way, if they do get a bill in the mail, if they do find issues with, the insurance, like they're not having to figure things out on their own because that's very
Yes.
frustrating.
Yeah. Yeah.
We will coordinate between facilities and doctors and the insurance and everything like that. So we provide that service as well. But I don't want people to have so many clients that they can't do that. So it's all about sustainable growth for my team.
Understood. Wonderful. So now let's say, you went through your pregnancy and the first months, etc. First months, plural, with your child, of course. So now you're back to work. And you're back to usual, okay, to the current situation, that it will float, people will do their work. You've put everything in place for that to continue while you're away. What is it, if you had a magic wand, if I were to give you a magic wand and say, well, you can go and wave it, what would you change within your circle of influence? Okay. Of course, you can't change the cross of, careers and doctors and everything. So within your circle of influence, what is it that you would change from operations and from growth engine, the development?
Yeah, I think the biggest priority should be a development of leadership because the people that run the operation matter more than the operation itself. Because when I look at, so I'm in this office and there's 5 other insurance teams, I want to make sure that how much care and thought we take into things, how much integrity we bring to the table, that
Mhm.
needs to happen in every insurance team possible. And so if we are working together as leaders of teams, and we're all adopting that kind of mindset where we're putting the client's needs first and we're putting the agent's training first, then that's going to trickle and affect so much more the whole industry over time.
Sure.
But it's obviously, if people were trained a certain way, then you have to break old habits, break the negative processes and systems, and recreate the positive ones. But people have to be willing to do that. So if I could wave my magic wand, I would want people that are in leadership positions to have the same type of mindset that I do so that we can make this a sustainable long-term thing and we help as many people as possible.
Excuse me. And that is within the network that you were talking about, or in your
Yeah.
own? Okay, all the different
That's
independent
absolutely.
agents. Yes, yes.
Yeah. Yeah. Even though everybody's 1099, that doesn't mean that we can't come together and care about the industry itself.
For sure, absolutely. How many are you? How many of those are you?
Meaning?
Like, you're one of them. Okay, how many other leaders who have their own agencies and everything else?
10, and there's 10 in our office that are at my level, and a few that are even, above and below that, so there's definitely people here and, every now and then we'll collaborate on things, so I absolutely think that this is possible.
And the building is a premises that comes with that network. The US Health provides this, or well, how does it work?
No, nobody provides it, so we all contribute to the lease, and we all contribute to, covering expenses, we all contribute
No, no.
to
How did you find yourself in the same building?
one person started it all. There's somebody that's been doing this for the last 20 years, and they've
Okay, so
slowly introduced us, and now we've grown over time. So I got recruited on in 2021, and then I grew with the company over time.
got it. Understood. Wonderful. All right. So thank you so much. All these insights, and it's an interesting model, and it seems to be really a model where you thrive and where you enjoy. As I said, like some element of structure and support, and at the same time, being able to you said spread your wings and take off the way you want, and you like it. So it's quite remarkable. Thank you very much. And first of all the very best for your pregnancy, and then maybe we'll reconvene in a year and see where you're at. I can't wait to see all the progress. Good ambition and good processes, obviously. Yeah.
Thank you so much. I appreciate you.
And good values and integrity, which I think is at the heart of your success. Yes. Thank you, Parita. I appreciate it. Okay, bye.
Bye.